Healers, caretakers, and medical practitioners have existed in virtually every civilization throughout human history. From the physician priests of ancient Egypt to the herbal healers of medieval monasteries, those who tended to the body's ailments held unique positions in society. While today we visit separate specialists for our various health needs, doctors for illness, dentists for our teeth, surgeons for operations, there was once a remarkable figure who combined many of these roles into a single profession. The barber-surgeons of Renaissance Europe stand as a fascinating testament to a time when the boundaries between beauty, hygiene, and medicine were far more fluid than we can imagine today. The roots of the Renaissance barber can be traced back to ancient Rome and Greece, where primitive surgical practices were already established. As classical knowledge disappeared during the early medieval period, monks became the primary keepers of medical texts and practices. When church edicts in 1163 declared that clergy should not shed blood, these medical responsibilities gradually shifted to the barbers who already visited monasteries to shave the monks' tonsures. These humble haircutters would eventually develop into multi-skilled practitioners whose services were essential to communities of all social classes. During the Renaissance, as cities grew and commerce flourished, barbers weren't just cutting hair and trimming beards. They were extracting teeth, setting broken bones, lancing boils, and performing bloodletting procedures believed to cure countless ailments. They operated not from sterile medical facilities, but from bustling shops that served as social hubs, medical centers, and grooming establishments all at once. Their iconic red and white striped pole, visible outside barbershops today, silently testifies to their bloody past, with the red representing blood and the white the bandages used in their procedures. Let's travel back in time and examine the daily life, practices, and social significance of the Renaissance barber, a figure who wielded razors and saws with equal confidence, and whose legacy lives on in many of our modern medical and grooming professions. Welcome to Folks of Yore. Picture this. You're walking down a narrow, winding street in 16th century Florence. The air is filled with the scents of the market, not all of them pleasant. You turn a corner and spot a familiar sight, a wooden pole painted with red and white spiraling stripes jutting out from a shop front. This isn't just any shop, it's the Barber-Surgeon's establishment, one of the beating hearts of Renaissance urban life. Unlike the medieval period, when barbers were often itinerant workers traveling from town to town, Renaissance barbers had established themselves as respected members of the urban landscape. They had their own guilds, their own regulations, and their own fierce professional pride. While physicians existed, they were university trained, expensive, and typically only treated the elite or more serious illnesses. For common folk, and sometimes even for nobles, the barber was the go-to healthcare provider. Let's take a step inside a typical barber's shop. The space is usually on the ground floor of a building, often with large windows to let in natural light, crucial for the delicate work of shaving and surgery alike. Shelves line the walls, holding an assortment of tools that would make modern healthcare professionals shudder. In the center of the shop, you'd likely find a sturdy chair where customers would sit for their procedures. Around the periphery, benches allowed waiting customers to observe the barber's work. Yes, those procedures were public spectacles. Just imagine waiting for your haircut while watching someone screaming while getting a tooth pulled without anesthesia. Talk about entertainment. And speaking of entertainment, barbers often kept musical instruments in their shops. A lute or a small harp might be passed around for waiting customers to play, creating an atmosphere more akin to a social club than a medical facility. Some barbers were accomplished musicians themselves, adding entertainment to their long list of services. Now let's talk tools, the extension of a barber's skilled hands. Their toolkit would make modern medical professionals recoil in horror, but many of these instruments were ingeniously designed for their purposes. The most basic tool was the razor, used for shaving beards and also for surgical incisions. Straight razors were honed to an incredible sharpness, and a barber would typically own several, keeping them meticulously clean and sharp. For bloodletting, a procedure we'll delve into shortly, barbers used a fleam, a specialized blade designed to make precise, controlled cuts in veins. They also employed scarificators, mechanical devices with multiple blades that made several shallow cuts simultaneously. Tooth extraction tools resembled modern pliers, though considerably cruder. The dental pelican, named for its resemblance to a pelican's beak, was particularly common. This instrument would grip a tooth while leverage was applied to extract it. In his 1543 masterpiece, De Humani Corporis Fabrica, Andreas Vesalius illustrated various surgical instruments used by barber-surgeons. Though Vesalius himself was a university-trained physician, he recognized the practical skills of barbers and included their tools in his revolutionary anatomical work. Ambroise Paré, who rose from barber-surgeon to become one of the most celebrated medical figures of the Renaissance, wrote extensively about the tools and techniques of his trade. Initially lacking formal education, Paré learned through apprenticeship and practical experience, the typical path for barbers, yet became so renowned that he served as royal surgeon to 4 French kings. "I dressed his wounds, but God healed him," Paré famously said, reflecting both the hands-on nature of the barber-surgeon's work and the recognition of its limitations. Now, I promised to explain that iconic red and white barber pole, and here's where things get a bit bloody. The common medical procedure performed by Renaissance barbers was bloodletting, based on the ancient theory of the 4 humors. According to Galenic medicine, which dominated Renaissance medical thinking, the human body contained 4 humors: blood, phlegm, black bile, and yellow bile. Illness occurred when these humors became imbalanced. Too much blood, that required bloodletting to restore harmony. The procedure was simple but messy. The barber would tie a tourniquet around the patient's arm, locate a vein, usually in the crook of the elbow, make an incision with a fleam, and collect blood in a bowl. The traditional barber pole represents this process. The red stripe symbolizes the blood, while the white represents the bandages, and the pole itself mimics the staff patients would grip to make their veins more prominent. King Henry VIII granted a charter to the Worshipful Company of Barbers, formally recognizing their bloodletting role. The charter specified that barbers should display a pole with blue and white stripes when performing their haircutting duties, and red and white when offering bloodletting services. Over time, these merged into the red, white, and blue pole still seen in America, where European poles typically maintain the red and white pattern. Leonardo da Vinci, the incomparable Renaissance genius, created detailed anatomical drawings showing the venous system barbers needed to understand for effective bloodletting. Though da Vinci wasn't a barber himself, his work demonstrates the intersection of art, science, and practical medical knowledge that characterized the Renaissance. If you think a visit to the dentist is unpleasant now, imagine having your tooth pulled without anesthesia by someone who just finished cutting someone else's hair. Dental work was a significant part of a barber's practice, primarily consisting of extracting decayed or painful teeth. A patient with a toothache would sit in the barber's chair, possibly given a strong alcoholic drink to dull the pain, or they would simply squeeze the arm of the chair as hard as they could, and then, well, let's just say it was over quickly, not painlessly. The barber would use a dental pelican or dental forceps to grip the offending tooth and pull it out. In his writings, Ambroise Paré, that famous barber surgeon who worked his way up to treat French kings, warns his fellow tooth pullers about the dangers of getting too enthusiastic with their dental tools. He cautions that a really aggressive extraction could cause concussion to the brain and eyes. Imagine explaining that to your customer who just came in for a toothache. The master barber surgeon really drives home the importance of a gentle touch. Pull with too much force and you might tear off a piece of jawbone along with the tooth. According to Paré, this dental disaster could spiral into fever, festering, bleeding, and in the worst cases, death. Perhaps the most entertaining is Paré's cautionary tale about a barber-surgeon's assistant who, when trusted with the pelican tool, managed to extract 3 perfectly healthy teeth while completely missing the broken one that actually needed removal. Talk about a rookie mistake. This is why Paré stressed mastering your dental instruments before unleashing yourself on the unsuspecting public. Preventative dentistry didn't really exist, though some barbers did offer teeth cleaning services, scraping away tartar with metal tools. They might also provide dentrifices, tooth cleaning powders made from crushed herbs, bones, and sometimes abrasives like brick dust. I think I'll stick with my modern toothpaste. Beyond bloodletting and dental work, barbers performed a surprising range of surgical procedures. For minor ailments, they lanced boils, treated wounds, set broken bones, and applied leeches, another method of bloodletting to target specific areas. More ambitious barbers might perform amputations, typically necessary due to gangrene or severe injuries. Without anesthesia beyond alcohol or opium preparations, speed was essential. A skilled barber could remove a limb in under a minute, using a saw and cauterizing the wound with a hot iron to prevent fatal bleeding. Barbers also conducted cataract surgeries using a technique called couching, where a needle was used to push the clouded lens of the eye out of the field of vision. The results were mixed at best, but it occasionally restored some sight to the completely blind. The 1540 unification of the Barbers' Company and the Surgeons' Guild in England formally recognized what was already happening in practice. Barbers were performing surgical procedures regularly. The resulting company of barber-surgeons was granted the right to dissect a limited number of executed criminals annually, allowing them to study anatomy firsthand. With all this talk of blood and teeth, let's not forget the more familiar aspect of barbers' work, hair and beard styling. Renaissance fashion placed a great importance on hair, and barbers were the keepers of these cosmetic arts. For men, beard styles were particularly significant indicators of status and fashion sense. Baldassare Castiglione's influential 1528 book, Book of the Courtier, advised gentlemen on appropriate grooming. He proclaimed that the hair should be rather dark than fair, not arranged with womanish care. The beard should be fuller upon the cheeks than upon the chin, but not left wholly untrimmed. Different regions favored different styles. The forked beard, popular in England during Elizabeth I's reign, required regular maintenance. The spade beard, preferred by Spanish nobles, needed precise cutting, while Italian merchants often chose a rounded style. All these were the domain of skilled barbers. Women rarely visited barber shops, instead having their hair dressed by ladies' maids or dedicated hairdressers who sometimes made house calls. However, barbers might be called to noble houses to cut women's hair or to provide treatments for hair-related concerns. During plague outbreaks, barbers took on additional public health responsibilities. Their experience with bloodletting and minor surgery made them useful in treating plague buboes, the swollen, infected lymph nodes characteristic of bubonic plague. Paradoxically, while trying to help, they probably spread the disease further through their interventions. In Venice, where plague repeatedly struck during the Renaissance, barbers were sometimes hired by the city to perform autopsy on suspected plague victims, determining if quarantine measures needed implementation. How did one become a barber in Renaissance Europe? The path began with apprenticeship, typically starting around age 12 to 14. A boy would be placed with a master barber, learning through observation and gradually taking on more responsibilities. After 5 to 7 years of apprenticeship, he would become a journeyman, working for wages but still under a master's supervision. Only after demonstrating sufficient skill and raising enough capital could he attempt to become a master himself, setting up his own shop. Guild regulations strictly controlled who could practice. These guilds functioned like combinations of professional associations, regulatory bodies, and social clubs. They maintained quality standards, controlled prices, limited competition, and provided support for members' families in times of illness or death. guilds took their regulatory functions seriously, protecting both their collective reputation and the public. While most Renaissance barbers lived relatively ordinary lives, a few rose to extraordinary prominence. I've already mentioned Ambroise Paré, who began as a barber-surgeon and became one of the most important medical innovators of his era. His practical experience led him to challenge established medical dogmas, particularly regarding wound treatment. After observing the horrible effects of treating gunshot wounds with boiling oil, the standard practice at the time, Paré instead used a soothing mixture of egg yolk, rose oil, and turpentine. The next day he found these patients in far better condition than those who received the traditional treatment. "I resolve never more to burn thus so cruelly the poor wounded," he wrote. In Germany, Hans von Gersdorff, a barber surgeon who treated wounded soldiers, published Feldtbuch of Surgery in 1517, complete with illustrations of surgical procedures. This practical manual helped spread knowledge among barbers who might not read Latin, the language of formal medical texts. As the Renaissance progressed into the 17th and 18th centuries, the diverse roles of the barber began to separate. Surgical procedures increasingly became the domain of formally educated surgeons, while haircutting and shaving remained with barbers. In France, this separation was formalized in 1743 when barbers were officially forbidden from performing surgical procedures, and surgeons were prohibited from haircutting and shaving activities. England followed in 1745 when the Company of Barber-Surgeons split into two separate entities. By 1800, the Renaissance barber who could cut your hair, pull your tooth, and let your blood had largely disappeared from European cities, replaced by specialized professionals. However, in rural areas, barbers continued to provide basic medical services well into the 19th century. Today's barbershops, with their spinning poles and focus on men's hairstyling, are distant descendants of the Renaissance establishments. But the barber's legacy extends far beyond haircuts. Barber surgeons, through their practical experience and innovations, helped develop many surgical techniques. Their hands-on approach sometimes led to discoveries that theoretically oriented physicians missed. Their tools evolved into modern surgical instruments, and their practice of public demonstrations eventually transformed into the medical theater used for teaching. When you visit a modern physician, dentist, or surgeon, you're benefiting from knowledge that passed through the hands of countless Renaissance barbers. And when you see that spinning red and white pole outside a barbershop, you're looking at a colorful reminder of their bloody but essential role in medical history. From bloodletting to beard trimming, from tooth extraction to haircuts, the Renaissance barber performed an extraordinary range of services that modern professionals would never combine. They were healthcare providers for the common people, stepping in where physicians were unavailable or unaffordable. They were skilled craftsmen, regulated by guilds and trained through the years of apprenticeship. And they were community fixtures, their shops serving as a social hub where news spread and local issues were debated. Next time you sit in a barber's chair for a trim, spare a thought for their Renaissance predecessors, whose skilled hands might just as easily have performed surgery as styled hair. They may not have understood germ theory or had access to anesthesia, but these remarkable individuals helped shape the medical professions we rely on today. Thanks again for joining me on Folks of Yore, where we tell history through the eyes of those who lived it. If you enjoy this exploration of historical professions, let me know in the comments which other Renaissance occupations you'd like to learn about in future episodes. Don't forget to like and subscribe and hit the notification bell to make sure you don't miss a future video.